Good afternoon. Thanks everyone for showing up this afternoon. I appreciate the organizers keeping the place so cold so we all stay awake. And it seems like folks don't like flies. So I don't know, maybe we scared a few of them off with the title. Dr. Douglas is not here today. He welcomed a new member of his family not too long ago, so he's managing that little wrangling. Tons of fun, those little ones, but he's sorry he can't make it, and hopefully I can carry things properly in his absence. So, horrifying title, Who Let the Flies In? What we wanted to talk about, though, are some things that we think are coming down the pipeline in terms of concerns, questions, and what else may be of interest to understanding the products that we're using and understanding how to best utilize the compositions of interest to ourselves and especially to medical patients. It's probably not lost to anyone here, especially in the cannabis arena, about EVALI. It actually did happen. We had concerns with products that were being utilized for vaporization. Where those products were at, what exactly was in all of the compositions of them, how many of them actually persisted. Unfortunately, the pandemic certainly curbed the CDC's reporting, kind of sucked up all the resources. The last update was February 25th of 2020, actually on the EVALI website on the CDC's homepage there. So we do know it happens, we do know it can happen. So how do we think about what happened, what have we learned from it, and how do we best avoid it? And a big piece of that was we really need to consider what we do for inhalation. The molecules that we're going to inhale are very different in terms of a toxicological profile than what else we've used them for, whether it be topical use, even oral ingestion routes. Our lungs and our route of ingestion through inhalation is very different than if we are to consume them orally or apply them topically. And to consume them via inhalation, we have to heat things. So the rule in chemistry is about every 10 degrees in Celsius, chemical reaction rates may double. And that's not a very big temperature change when you start to think about how hot some of the handheld devices might get, how hot a vaporizer might get, e-cigarette hardware, and especially when you go all the way up to combustion. So it's something to not overlook. It's something that we definitely have to consider. And we need to kind of pay attention to what might be the molecular fate. What might these things decompose into? How much of them might be around? And how do we actually concern ourselves with this before we put products out in the marketplace so that we can avoid a situation like we saw with the EVALI cases. What's presumed to be the major culprit that formed EVALI is shown here, vitamin E acetate. And we believe, chemists believe, that it is the phenolic acetate function that caused that to happen. If you heat that hot enough, you start to see it break down into a molecule we call ketene, and this is a highly reactive molecule. So this molecule is most likely what was causing the chemical burns and the problems inside the lungs and the airways, and it forms when you really, really, really heat compounds like this. One current concern that I've got, we heard it mentioned a little bit earlier today, THCO or THC acetate. It's also a phenolic acetate. Now, I don't think anyone's done thermal degradation studies on it to see its propensity to form ketene. It may or may not form ketene under typical conditions in vape hardware. And it's still a question that's out there, and hopefully we don't see other problems like we saw with vitamin E acetate. It's also interesting that vitamin E acetate may still be going around. Not everybody necessarily got the memo, and it raises the question, is that related to vitamin E acetate in specific hardware, or was it always just that molecule? So what temperatures do things get to? How hot are these devices? What does the molecule experience for which period of time? All important questions. And I want to highlight the point that vitamin E acetate is GRAS. It is generally recognized as safe for uses in foods. So it's not generally recognized as safe for any and every use, certainly not for inhalation. This work presented here is work from the Strongen lab in Oregon State, and they were exploring cannabinoid degradation. What's the fate of cannabinoids when I heat them up via a vape cartridge or via dabbing where the temperatures might be a little hotter? They used both delta-9 THC and CBN. And you can see that the volatile organic content actually comprises a number of different molecules. And I'd like to highlight that there is acetone seen on the top two as well. So, and I'll bring that up a little bit later. But I think that the basic takeaway from this is it's not only THC all the time, right? So I start with THC, but if I heat it up, it might decompose. It falls apart into other molecules, some which may be of interest, some which may not be. And those things are really what's going on when we're heating vape devices, we're utilizing those, and through combustion processes. So we had previously published, we know how much is in a pre-roll, and if you go and combust that, you do not find 100% of the THC going into the airway. And in fact, you can't find all of the THC's fate because it breaks down to things like this, which are hard to capture. Terpenes, unfortunately, do the same thing. And depending upon which terpene you have, and again, which temperatures you've got, you will see them start to degrade in different ways, and you will see a different profile of the other volatile substances that form. And here, I'd also like to note that acetone is a lot more prevalent. I don't know if there's a laser pointer on this one or not, but it's, you know, the second one. Apologize for the chemistry. The second one on the myrcene one, acetone. The third one on the limonene one. So we see certain amounts of acetone. And again, I'll bring that up a little bit later. And beta-caryophyllene forms predominantly acetone along with some others. So we've got a little bit of a clue about what might be going on when we start to heat these molecules under different conditions. And again, it is very condition specific. So we produced pure terpenes, complex blends from them, and we started to do a lot of analysis, and you start to see testing laboratories come back with residual solvents. You're like, how does this start to happen? You know, where is the solvent coming from? Because it's not okay to put any solvents into these products. They shouldn't be around. And if these materials are coming from distillations, they should have no solvents such as acetone or the other light volatiles in there either. There really wasn't a rational reason for why these things might be showing up on the tests. So the first part that we did was, let's just take a vial, an empty vial, put it out there in the lab atmosphere and see if there's acetone floating around and maybe showing up on some of the results, because these methodologies are very sensitive and can detect these things at very low levels. Residual solvent analysis is done via headspace analysis with GC-MS. So it is a sensitive technique. You can see very small amounts of these things. And it is possible that you've got, you know, a lot of acetone in a lab or other solvents that might be confounding these results. We did not see that here. That first block there is the empty vial. Didn't matter what happened in there. There was not a lot of acetone present in the lab or even in the vials. Then we tested a series of other pure terpenes and terpenoids. We also mixed them all together 1:1:1, and we made a complex formulation that mimicked one of the cultivar profiles that we've seen as well. And you can see each of them started to show this general trend. And it's a little hard to read perhaps because it's small, but the first data point on the left is when we took the vial and purged it with argon to try and flush away as much of the lab's atmosphere and impart a neutral, inert atmosphere of argon into the vial, sealed it, and used that inside the injection. The next one is just laboratory air that was pushed in after we flushed with argon, so we tried to fill it up with air. And the third data point was when we added something with a high oxygen content, so boost oxygen type stuff that we bought. Let's try to put as much oxygen in there and see if we start to see other degradations. And mostly, we did. We saw that the lab atmosphere had a certain amount. When you remove that atmosphere, you don't see it. It's argon-based. It's very low in numbers. And when you add oxygen, you see those things go up a little bit. And the results were all statistically significant. And then we started to think, well, I don't see it all going down to acetone. What else might be happening? And this also tells us that our sample preparation is critical to analyzing exactly what's there. So a big part of analytical chemistry is, how do I know what I'm holding, and how do I get it to some sort of detection method that has not altered exactly what I'm holding in my hand? And this kind of told us that these residual solvent analyses probably need a little work in sample prep. The injector temperatures in the GC, the methodologies of getting those vials warmed up to put the volatiles in the headspace, all of those might have an impact on the overall chemistry of what's going on in the vial. And that's not necessarily representative of what I'm holding in my hand or what's been placed in my vape cart or other product composition. And when you look into degradation, I don't know if everybody might have heard the talk earlier today about the environmental chemistry that goes on. There's some pretty wild stuff that actually happens to some of these molecules over time under the right conditions. And here's just a picture of some of the pathways that go on in that regard. Air, oxygen, other types of things can catalyze those reactions. Certain hardware inside of vape hardware or metal catalysis might actually be a part of that. We tried to add a little bit of things to accelerate some of this, and we didn't see any great accelerations. We think oxygen in the normal air was the major culprit of these things, but there's still a little bit more work ongoing before we're actually going to publish all of the results in this paper. But it does tell us there weren't really these solvents inside of the formulations that were produced or these pure terpenes that we're getting. It's predominantly coming from analytical methodology. And I think that was an important piece. Hopefully others will start to adopt different analytical methodology towards understanding how to get good residual solvent results from compliance tests as well. And it made us start to think, like, could we model potentially vape hardware, vape effluent streams utilizing gas chromatographs. So is it a really big, giant vaporizer? In some sense, I've got a liquid that I'm going to put into an injector. It's going to heat to a certain temperature. It's going to try to aerosolize or volatilize the molecules that are in there. And then they're going to travel down the path and we can detect them. And if you look at a handheld e-cigarette, it's pretty similar. I've got a liquid in there. It starts to get hot to a certain temperature. Air flows through it, and these molecules go down an airway. Happens to go into our airways. But those two things are pretty similar, so I think there's a glimmer of hope that we might be able to model some vape hardware in certain fashions, or at least glean toxicological perspectives on what types of molecules may be formed in which amounts from the breakdown of the compositions that we're using inside of these e-cigarette hardware pieces, or concentrates, dabs, or even other inhalable products. And it's important to note, this is probably a good picture. Brad put this in there. I'm mostly vegan, so he made sure that we showed the steak to everyone. But you can all assess, different things change via time and temperature. So the hotter I've had my steak on the grill, the longer it's been there, the less rare it is, the different in color it is, the different taste and flavor, and the different smells that I get. And all of those are telling us there are chemical transformations and chemical changes that are going on. And again, it's the time and temperature relationship. So it's important to note that GC liquid samples, what I place inside this, auto sampler, isn't always what the detector is going to be only looking at. My injector temperature may change things, and different chemistry may even happen before it goes all the way down the path to the detector. And it's important to consider that that's also probably happening to some degree inside of the vape hardware. So my cannabis extract, my cannabis formulation may be different than what's actually hitting my lungs. To which extent, I think is a very, very difficult, complex, and technically challenging problem to answer. I don't want to send alarm bells off. We've been seeing lots and lots and lots of inhalation use for lots of time, and we don't see many, many acute problems. I think the number of EVALI cases up to February of 2020 was only around 2,800. There are probably tens of millions of folks that vape almost every day. So I want to keep the number in relative perspective. No one deserves any of that harm, so even one is an alarming case. But it's not like we're seeing, tens of millions or hundreds of thousands every day presenting with this problem. That would be a very different scenario. Unfortunately, we kind of confound what's going on with the chemical compositions and the profiles by playing the name game. So we published early on, 2015 I believe it was, how your chemical profile on a flower might not represent the name. So a lot of folks will call something Blue Dream or OG Kush. It doesn't mean that every one of those has the exact same Blue Dream or OG Kush chemical profile. Unfortunately, there is no nomenclature that's fixed towards chemical compositions. This goes further when you even say that this flower was what I used to do my extraction. In this case, it was diamond dust. And when that flower was extracted, I have a diamond dust concentrate. So I think for most of us, most general consumers, the assumption is, well, all the molecules I wanted just perfectly went exactly over into the concentrate because that's what I wanted them to do. chemistry experience tells me the molecules almost never do exactly what I want to do, like ever. And here is a kind of a graphical representation showing, yes, you pulled some of them off, but they're now in different ratios, they are in different types. You probably have isomeric or oxidative things that have happened throughout that extraction process. And there are prevalent pieces like this, no matter what your extraction process is. I do not have a perfect process to remove only cellulose or only amino acids and leave behind just the cannabinoids and just the terpenes exactly as the flower produced them. So I think, we hear a lot of talk, and recently there's been a lot of talk in California because the Department of Cannabis Control just released some draft regulations talking about which terpenes or terpene types ingredients might be useful for inhaled products. And a lot of folks thought that their extraction for cannabis-derived terpenes meant that it was exactly what the flower presented. And that is unfortunately not the case. So it's probably good that we've got greater diversity, but something to pay attention to and something to know. I can't say my Blue Dream flower necessarily always drives the Blue Dream concentrate effects because those compositions are very different. There are approaches that you can use using individual molecules that will get you to replicate the flower's profile in a much greater fashion. So with far better precision and accuracy, you can drive profiles that look exactly like the ones the flower produced. You of course have other flexibility that goes along with that as well. But in that case, you can say this is far greater representation of what was on the flower. Doesn't mean that any one of them is any better than the other. It just means that this is an exact copy, or as close to exact as we can get today, of what the flower produced. And if we are trying to say, hey, we understand these flowers, we understand their use, and the patient populations that are benefiting from them, here's how we can put those profiles into other products, such as inhalable products like vaporizers, other concentrate forms, or infused products like tinctures, topicals, and edible products as well. Keeping those profiles consistent, standardized, and highly scalable is what is really important to medical patients and the medical population. And I think also to adult brands that say, look, I have a consistent product. So consistency, as we heard from the cultivation efforts earlier today, very, very difficult to come up with the exact same profiles every single time. How do I treat a molecule as a molecule and replicate that in a standardized, scalable fashion? Using the individual components and formulating them will lend towards that type of approach, and I think leads to great scalability. And that is a good representation of what the flowers produced. Importantly, we think it is kind of a good collective time for all of us to start considering inhalation safety. We know that the large bulk of the dispensary shelves today are inhalation products, whether they are flowers that are being consumed, concentrates, or vape products, right? Those things can comprise the significant portion of cannabis products today. There are also some unique benefits that are imparted by inhalation products. Certain medical patients and patient populations really demand that type of rapid response. They demand that type of effectiveness, and they're not finding it from other delivery forms. So inhalation does offer a unique route, and I think it's kind of a critical part for us scientists to say, how can I develop this in a very intelligent way to lend towards the lowest toxicology perspective possible while delivering standardized, consistent products for patients to benefit from. We all got started, at least I got started, because of medical cannabis. Now, most of California has forgotten the word of medical of late, most of the West Coast too, but they are an important part of this population. They are still driving a lot of the adult use store sales and volumes, and I really think it's important that they are never forgotten. Like, this is important to keep a very good quality product that is standardized and consistent so these patients can get that benefit and relief that they deserve and that we all have been fighting for and continue to fight for. It's, I think, important upon us today to say, let's come together and start to talk about inhalation safety. Let's try to educate regulators. We can see in different states that some of them certainly don't know chemistry very well or are not really understanding some of the nuances that go with inhalation safety. The Food Extract Manufacturing Association had this problem a while ago. They convened their own panels, they got together and they said, let's start to understand how we can assess the toxicological profile of these extracts that we're producing. How do we know they'll be generally recognized as safe for use in foods, at which levels? And it's important, I think, that the cannabis industry understands that and tries to model that. It's also important that we do not let happen anyone consider cannabis to be just like nicotine and tobacco? They are very, very, very different plants. They have very different uses, very different chemical profiles for importance and use. And it would be remiss to all of us if someone says, well, let's just treat it like tobacco. That would be a problem, and we would leave a lot of people in a bad position that are looking, to cannabis for medical purposes. So a good start might be, hey, let's take the information in the body of knowledge that we know that was generated by things like vitamin E acetate or things that we've seen other studies with that says, let's not use those for inhalation. Or these are the things that are found in the cannabis plant. We've been inhaling and consuming them even at combustion temperatures for a while. Let's say that those things are pretty okay and start here, because building this body of toxicological work is going to take a considerable amount of time, money, and effort. So we won't have this answer next week, even if we all decided to lock ourselves in this room. It will take a lot longer than that, but we have to start somewhere, and we can't start with just some regulator saying, I think this makes sense. I think that's going to lend up to being much more problematic, and really trying to unwind some of those things can be very, very difficult. So some of the key points that I want to make sure everyone understands is the compositions change with all of your process steps. So anytime I do anything, even if that's setting up my analytical sample, I might see changes in the chemical composition that I thought I was dealing with or that I put inside of a formulation or a specific device. Extraction changes them, and heat is the major culprit, and heat accelerates degradation with oxygen, air, and other things that are floating all around us. It's very important to get your analytical methodology right. I think a lot of current labs today don't have the residual solvent methodologies super dialed in. That's why we're seeing some of these nuances, but we don't always see a lot of products fail for compliance testing. But there's a way to kind of tighten this up in a simple fashion, make it easy and more robust, and we'll get more accurate understanding of what's going on. I think understanding aerosol testing, like the work out of Strongen's lab and some others now that are kind of getting along with this, that field is advancing, and using gas chromatographs to kind of understand what we might see in these, heated effluent streams out of vape devices, or even via concentrate consumption and other inhalation means, is very important towards informing our toxicological perspective and understanding of which molecules might be best on a permitted or prohibited list. And again, the name game still persists. I don't know how to solve this one yet. Maybe someday in the shower we'll get a good idea and we'll actually say, like, this is a good answer. It's a complex problem. It hopefully will start to get less, I'd say less problematic as things start to be standardized and more consistent. If we can start with consistent cultivation, consistent processing methods, we should all be able to lead towards more consistent products in the end. And as I described, there are a couple of approaches that might really help us elucidate consistent formulations and chemical profiles of those products. I thought this was a little bit of a funny one, but chemistry is definitely not to be feared. Nothing in life should be feared as long as you can understand it. I thought this was funny until I was sitting there talking to a legislative aide and a staff member that were trying to write rules and regulations around hemp and the novel cannabinoids. And the first thing that I got after I was introduced by an independent third party, they said, oh, I did terrible in chemistry and failed on math. I was told that there wouldn't be much of that here. And I'm like, well, delta 8, delta 9, delta 10, and all these other things I'm going to start throwing at you are all chemistry. So other than giving you copy-paste language, I don't know how we can help, but we have to have a conversation. It's not impossible to understand, but these things are what are important when we're talking about what can patients and consumers access, what might we be putting into the public sphere, what might cause harm or not. And we do, unfortunately, not have a lot of science-minded folks that are writing the rules, regulations, or legislation, especially the legislation. Most of them seem to be English or legal majors. They are fearful of the word chemistry and math, I can assure you. I've seen it firsthand. But I try to gently offer education and always available for support. And I think most of us scientists are always happy to have the conversation and educate. So don't be afraid of it. It's not a bad word. Chemistry is actually okay. I've got my little boy saying molecules already. He's under 3. It's fine. But understanding the world around us and what we can get from that is really the important piece of that. And thank you all for your time and attention today. I appreciate it. Happy to take any questions. Dustin.
Wondering if you had just a minute or two to teach a patient how to shop for a safe product, what would you say?
Good luck. No, I'm just kidding. I get this question a lot. So how do you enable a patient with just a minute or two? Like, what's the best way to go about it? Do as much research as you can on the producer and their consistency. Find certificate of analyses. They're supposed to be available in most states by rules and regulation. You would be surprised how hard it is to try and get those, even when they are supposed to be available by rule. But you can, if you are persistent, so be persistent, do your research, go find all the C of A's that you can, and you can probably pretty quickly assess standardized product and process relatively quickly. If you start seeing numbers with wide ranges, if it's at the same lab, that lab is probably consistently doing the same thing. They might be off the center of the target, but they're consistent. So a relative consistent analysis showing me inconsistent profiles tells me there's a lot of variability going on in the back end. And then try through experience and communication. Have you tried different batches? Do you know, like have that conversation. Do you know, have these been consistent for you? It's tough because we're all, variable every day, right? So even if I get the same products, I might need a little more, a little less from day to day. But through certificate of analysis research and then ask a testing lab or, come back to the doctor and say, I found these 10 things, what do you think? You probably can assess pretty quickly, not the producer, or yes, that's the type of producer for me. It's like the best that we can do today so far.
How about inhaled, like cartridges? Like what if somebody wanted a safe cartridge? Same methodology or anything else special?
I think, so if I'm looking for an inhalable product or a vape cart, how do I assess that from a patient or consumer perspective? Yeah, what's on the label? What else might be going into there? I'm not fearful of synthetic or natural labels. I think there's a misnomer. Natural means safe. Well, ricin, belladonna, other things, they're all toxic, right? Poison ivy, natural, totally not safe. What molecules are being used in them? Are there any in there that might cause concern? Have I seen that from other states? That's pretty complicated and difficult, I think, for most of the general population to do. But states are starting to require disclosures on some of the molecules in there. I think there's a problem with that where you start to read some of these things and you're like, I can't even pronounce them, right? They're too big. What does that mean? If I read a report, it might really be off because that toxicology report might be on the pure substance. And at high concentrations and just that molecule, it might be bad. But in a vape cart, it said a fraction of a %, and it's really okay. The dose makes the poison. So I'd say, consistency of production, are you seeing the same effects if you used it from batch over batch? And what's on the label and what do you know about it? Ask the producer. If they're trying to answer in a very good fashion, you could probably feel more comfortable that they felt confident. But if they're like ducking the question, that's probably a flag to say they either don't know or they don't want you to know, and you can probably move on to someone else that would be more transparent. Our GC analysis on acetone was residual headspace solvent analysis with GCMS. So there are headspace files that were capped and sealed, placed in the headspace autosampler, warmed up to temperature, injected, and then hit the MS. And then we could see acetone was like one of the major culprits. There are some other things that you could see, obviously the ones that California's residual solvents on the list that they look for, but you can't detect everything. So that big complex picture says there's all sorts of other stuff that probably is present, but the lab's not tuned to look for. So when you see a small amount of acetone, yeah, that's there. And in that slide, it was at, I think, 6.7% or so. So that's what that broke down into, but it broke down to a lot of other stuff that you're not detecting. So we're gonna try to see how much of the actual terpene is left. It's a little tricky experiment, but that's how we got there. No, we didn't do it that way. No, we didn't have, and that would be an interesting one. Like if I inhaled and then exhaled, what did I catch out here? Well, what did I keep in my lungs and bloodstream too? I could see maybe traces of some stuff, but my concentrations go down and it gets harder. You can hook up e-cigarettes to devices. Strongen's lab's done that. We've done some of that where you say, I've trapped all of the vapor stream coming out of an e-cigarette device or even a pre-roll. What do I see this way? And there's a couple of technical challenges with what did I trap? How did I trap it? Am I sure I got it all? Is it stuck in a tube before I got there? How do I figure out the entire mass balance? Like if I started with 100 molecules of these and it broke into 30 things, how much of each of those equals that 100 molecules, you don't always get there, and it's a little frustrating, but it's because I'd probably need 5 different detection methods to kind of make sure I could fill out the whole picture, and that's just too costly to do right now. Sure. You have,
Live rosins compared to obviously hydrocarbon injections. Have you really looked at that? Is that safer for actually in that cartridge? You have live rosins?
so the live rosin, live resin, hydrocarbon extracts, sauce, batter, butter, whatever you want to call it these days, CO2 extracts, any extracts composition is different than the flower. Are they any safer, better? They're all different, right? So I don't know if we should use words like safer or better. I hear a lot of folks like, I think this one's better. Great personal opinion, thank you for that. Maybe I could try this one or the others and we'll see if I agree. But you're not telling me anything other than your personal opinion for what you think is better. What's best is what's right for the consumer and the patient and what they get the best results with, which may be very different than what that person thought was best. They produce different profiles. Some of the live rosin or other things might have higher contents of other molecules like fats and waxes depending upon how they actually go down the process. And not all those processes are exactly standardized or exactly the same. So 2 different producers, even doing a live rosin type of process, may produce very different things from the same plants depending upon exactly how they do it. Are they bad? I mean, I think they're solventless, so you haven't introduced anything. You have a pretty good composition that you're resulting to, but that again is different than what I started with the flower, and there could be things that change terpene compositions in that, right? So I've got pressure, that's similar to heat. If I've done any sorts of things that have tried to touch these molecules, they may oxidize, they may isomerize, they may come into different things. So some folks we know took like cannabis-derived terpenes and threw them through the analysis, and you're like, well, I can see about half of what's here, even though I thought I saw a lot of this stuff to start with on the flower. It's become a lot of other things that are similar in structure, so they're probably isomers or other oxidative degradants from that, and it's not the same. Are some of those allergens, sensitizers, could they be irritating to folks? We do know that some of these molecules may become ones like that, but we're not seeing everyone present with tons of problems, but you do have some folks say, I was irritated by that one bothered me. We don't always know exactly why at a molecular sense. So again, it's hard to say better, best, or what's good or bad over which method. I think there's something for everyone. As long as we can consistently produce it, then we can start to understand what might be right for which types of consumers or patients. You have. So great question, right? So vitamin E acetate bad. We all know that for sure. Are there others? Some states have said MCT because of lipoid pneumonia. So we know if you have like mineral oil type ones, really long chain fats and fatty acids, those might pool in the lungs and you can't clear those. So you should stay away from things of that type. How long is that carbon chain until you get there is a great question. MCT, if we're relatively speaking, mineral oils like C40 and MCT can be like 9 to 12 or 15. I don't know, is that short enough to say it's okay, or is it still too long to be a problem? So I think the best approach is saying, what's in the plant? How do I use these things that people have been inhaling and consuming before, and try and keep those in relative amounts that are similar to the plant? Because I've seen that be okay over the test of time. Adding new things like that can be very, very tricky. I think, what's a good solution to that? We've seen other states take out squalane and squalene because they were concerned with some cases of that. Again, I think it's going to be really hard to say what's the best thing to put in there other than what we've already been seeing and could say, hey, this is very close. But you could say vitamin E was fine and vitamin E acetate looks very close and now it's not fine. So that's a very slippery, delicate slope, and I think it's really, really hard to assess without a great toxicological model, which we really don't have yet today. So staying close to the plant seems like the best place to start. Sure. Hi, Bonnie. Opinion of what? So are Delta-8 products derived from CBD safe or not? And, again, with the caution of what the word safe really means. So Delta-8, I think, is a fantastic molecule. It has a ton of therapeutic benefits. maybe even a wider therapeutic window than Delta-9 because it has mitigated psychoactivity for most folks, but yet it still has some, obviously, or we wouldn't be talking about it. I think if you make that the right way and you know all of your impurities in that process, it can be safe. Is it currently being produced like that out there today? I don't think there's many of that at all. There might be some, but I don't think that people are watching what else is formed. We've screened a few of these things. You see a lot of other cannabinoid-like molecules that are like there. We don't know what they are. It's possible that you can have very good, clean, safe Delta-8 products. Yes, I should be able to test them for heavy metals, pesticides, residual solvents, and the gamut that we do for all the Delta-9 products. But that's not required. Are folks actually doing that every time? Is someone checking that? I think that that's probably not. I think of the Delta-8 space probably more like 2012, 2010, California, where like everyone's kind of doing whatever they want and no one's really checking. There's some laboratory efforts that say, oh, I think I saw this, but there's been a lot of reports of, well, this group said there was no Delta-9, but another lab looked at it and there was a considerable amount of Delta-9 because they were trying to say it was legal to let that go, whereas it really wasn't. So I think the analysis is probably not really on par with all of those. I think, therefore, I'm not seeing all the other cannabinoid derivatives that might be forming. And I think you can do it very well. I just don't think there's a lot of that going on yet today. For the terpene analysis, no, we only did those in the headspace samples. So we did not try and put a pure terpene in like a vape cart or on a dab nail and try and see some of that. The Strongen lab did a little bit of that with myrcene and some other pure terpenes or a model cannabinoid composition, but we didn't do any of that work directly ourselves. Putting a pure terpene in a vape cart is actually a problem. The viscosity is wrong and it flies right through it most of the time. So they're not always built for that. So that's going to be a little tricky, I think. Sure.
With vape carts, I'm assuming the chemical structure may change from your first inhalations that you use to your 60th.
Very good question. Yes. Yep. So with a vape cart, does my chemical composition that I actually have in the cartridge change over time? Yes, it's very possible, right? Because I'm heating those things. And what temperature did I heat it to? How hot did it get there? How long was it? I think a lot of us have probably experienced, the end of this one seems a lot different than the beginning of that one. So you can taste it in some respects that you know that there are changes. What are all those changes? What did they become? I don't think that there's been much of any study on that just yet. But that is important work to do because the lifetime of that being effective in terms of dosing and what you're delivering to patients, or am I forming, bad compounds that I wouldn't want to be inhaling in that respect. That certainly is a theoretical possibility, but I don't have any data or information to share specifically on that. Right question, though. Sure.
Is there any data to suggest that some terpenes that are not in cannabis, when you heat them up to very high temperatures, they become carcinogenic?
Okay, great question. Are there any terpenes present in cannabis that if I heat them too much become carcinogenic compounds? So we've seen things become benzene, that's a carcinogen, right? So known carcinogenic properties of some of those degradants. So yes, technically the answer is yes. Do we see those at exceedingly large amounts that they could cause cancer? Are they overwhelmed by the anti-cancer properties of cannabis in general? I don't think we're seeing a lot of folks get cancer, and Dr. Tashkin did a nice meta study that said we don't see lung cell carcinomas in people that smoke cannabis. So while we're seeing these in the smoke stream, carcinogenic compounds that have formed via cannabinoids and terpenes being thermally degraded, do we have a cause for alarm for causing cancer? I think we would have seen, a lot of chronic cannabis smokers having cancer of the airways, the lungs, and other things like you see with tobacco, and we haven't seen that yet. So they technically form. Are they at large enough concentrations? I can certainly say the rat gets cancer when I dunk it in a bucket of benzene. But if I have 2 molecules floating around it every other day, does that cause cancer for it? It's a matter of dose that we get to in that regard. So technically they do, but are they cause for cancer alarms? I don't see that just yet. maybe we'll go with the last one and then I'll let Toby get up here.
How would you tackle the name of you have freedom to do it? Free count?
Sorry, I didn't hear the first part of the question.
How would you tackle the name problem of you have the free will codes without
That's a good one. That's a really good one. I probably lost like more sleep over this question than like any other cannabis question. So if I had infinite resources, I was the government. Oh my gosh. Well, now I can dream, right? What would we do about the naming game? I think we'd all have to start tagging a code, some sort of like large enough, sequence of code that it would be always unique, kind of like the blockchain, and say, this is what I meant by that. And then capture it what we can in a snapshot in time to say, well, what did you mean? And later, do I have any of it to kind of fill in some of those gaps? Would we see, possible groupings that come from that and say, cool, we can say that this has a little part of the code and then I can call it whatever I want. So I think today a good step would be, Bob's Blue Dream, right? So the branded version of whatever I wanted to call it. So we don't want to do away with all the lineage and all the history that got us here. There's some nice elements of that, and it can be very informative to folks. So you can't just scrap it and start over. But we may transition to a place, 50 years from now where no one really knew what Blue Dream was or cared much, because now we have new names that say, this is what it is. How do we get there with this bridge? Maybe it's, this brand's Blue Dream. Well, hey, when I had Bob's Blue Dream, it was different than Bill's Blue Dream. They both claim they started Blue Dream. They swear they got the clones from the same guy, and they very well may have. But their production process and their nutrients and their way they grew it and how they did it and how they brought it to me in the store ended up causing two different effects. So if I can brand and say, I'm doing this consistently, and I call this my Blue Dream, I think that's a pretty good place to start today. And then if we really said that has to go to the place that can test the daylights out of it, store it so that if we learn how to test them later, we can add those things to that info, that might be a way to go about it. But you'd probably have to be the government with large resources and the ability to say I can, stockpile all this cannabis for infinite times under cold conditions to do it. Thank you, though. Very good, fun question. Thank you again for your time.